This Wednesday, the CEO of United Healthcare was shot and killed in Midtown Manhattan. The response to the death was not that of sympathy, but it triggered a whole lot of memes on Reddit. I wondered, why would CEO of a company be hated so much that his death leads to not sympathy but memes? That's when I remembered how bad the situation of healthcare in United States is. Having lived in three countries, India, Australia, and United States, I've had an opportunity to experience the healthcare in each of these countries firsthand. And let me tell you, although US is one of the richest countries in the world, with healthcare spending being the highest per capita, even then the situation of healthcare is in a really dire condition. The healthcare in US is so expensive that people often stay in the hospital parking lots while fighting pain and only going in if the pain becomes unbearable or it stays for a really long time. Imagine you're the richest country in the world, but your citizens are scared of going to the hospital because of the associated costs. Compare that to a country like Australia, where the priority is given to a person's health and not making profits. In today's video from Global Desis, I just want to highlight the difference between healthcare in Australia, US, and India to show you how bad the situation in United States is. Cost of healthcare. Let's compare the cost of healthcare in the three countries I just spoke about. In Australia, India, and United States. Healthcare in United States is notoriously expensive. Even with insurance, you might end up spending thousands of dollars for something that might just cost about 10% of it in India and would actually be free in Australia. Let that sink in. Even with insurance, the Americans are paying more out of pocket that someone in Australia or India pay without insurance. No wonder that often many Americans try to go to other countries in order to get medical procedures done because their trip from US to the country and back and inclusive of the whole procedure might end up costing less than their expense if they want to get that procedure done in United States. In Australia, the public Medicare system takes care of all your expenses. When we were pregnant with my daughter, I didn't have to spend a single dollar through the whole process. Not even the parking is something that I had to pay for because that was taken care of because I had a private insurance. But the whole pregnancy itself, every visit, every ultrasound, everything was taken care by the Medicare system. It doesn't mean that I don't have to pay into it. The whole Medicare system is driven by the taxes that I pay. But at the end of the day, the whole procedure cost me nothing. So I know that the taxes that I'm paying are being used for welfare of people. India is slightly different. There, the government hospitals do provide services at extremely low cost, but the private hospitals are still for profit. But the point is, even in India, you do have an option to opt for something which is more economical compared to US, where I don't remember that being an option at all. Let me tell you a story. I had a friend who had a 3-year-old and he left her unattended for some time. When he came back, he noticed that there was a medicine kept on the table which was empty. Now he got really scared, wondering if her daughter actually drank the medicine. He took her to the hospital and it was found out that no, there's nothing to fear about. He said that the visit was hardly 30 minutes, but a few weeks later, he got a bill of $8,000. You might wonder, didn't he know beforehand how much he would end up paying? And that's the biggest problem. In US, they don't tell you upfront how much that medical visit is going to cost. So if you don't have an insurance, be ready to spend thousands of dollars for the most simplest of visits to your doctor. This is not a problem in Australia because the universal health coverage takes care of it. That takes me to point 2. US is the richest country in the world which spends the most amount of money per capita on healthcare. But still they don't have something like a universal health coverage. There's a very high likelihood that if you are in US, you won't even have a health insurance unless you have a job. Whereas in Australia, everybody is covered irrespective of whether you have a job or not because they value their citizens' life more than money. Even in India, which has a developing healthcare infrastructure, you have something like Ayushman Bharat that takes care of your expenses and ensures it stays low if you're an underprivileged citizen. Delhi has things like Mohalla Clinic, which can provide you basic services at extremely low or no cost. If a country like Australia and India can do something like that, why is it that a country like United States is not willing to give its citizens' health more priority than profits? Now let's talk about administrative complexities. The thing is, even if you have a private insurance in US, it's not as easy as just dropping into a hospital and getting yourself checked out. I remember when I was in US, I had an insurance through my workplace and I had to go for an emergency visit because I had a fracture on my right hand. The insurance documentation clearly stated that for an emergency visit, I have to pay $250 copay. Copay means the money that you have to pay out of pocket. So think about it. An emergency visit, even with an insurance in US, costs you about $250. That's about 25,000 Indian rupee and almost 500 Australian dollars. Something similar in Australia would actually cost me nothing, and in India will probably cost me 1/10 of the cost. So when I visited the hospital, I was not told upfront how much the whole expense is going to be, and they said the insurance should take care of it. A couple of weeks later, I kept getting these bills of varied amount for different reasons. I called up my insurance and they told me that I have to pay a certain amount out of it because the doctor who visited me in the in-network hospital that I was in was out of network. And so I have to pay money beyond the 250. It was so frustrating because it did not make sense that even if I select a hospital which is in network, go in, get myself checked, and they happen to have a doctor who's out of network, then I might have to pay more than the $250. Most likely because I was aware that I could actually contest that, and it eventually got sorted out with me having to pay only $250. But imagine if it is someone who's not as aware of their rights. What would happen to them? I had a colleague at work who had to get his appendix removed. At the end of it, he was charged $80,000 for the procedure. The $80,000 were brought down to $8,000 when my friend reached out to the hospital and the insurance. Imagine that. So their margin is crazy because if my friend wouldn't have resisted, they would have put him in a payment plan to pay off 80,000 US dollars for removal of appendix. So we spoke about the cost, the universal healthcare, and the administrative complexities. The next in line is the accessibility issues. In US, the richest country in the world, in rural areas, it's very likely that you wouldn't have access to hospitals, specialists, or even primary care. In Australia, you have an option to have telecalls with doctors, and then there are a lot of government facilities which can bridge the gap in having some kind of medical access, even in the most rural and remote areas. In India, although it's not as easy as Australia, even there is a strong network of clinics and mobile medical units available in the remote areas. The next is the biggest point. Focus on profit rather than life. The US healthcare system is extremely capitalistic in nature. They have made lives of their citizens a business. The insurance companies, the hospitals, the whole healthcare system is totally driven by profit. The government puts in thousands of dollars in research, and at the end of the day, whatever comes out of it is patented and sold at extremely high cost. Now, India might be not that different where the private hospitals are driven by profit, but you still have option of public hospitals to take care of your needs if you cannot afford expensive private hospitals. In Australia, everything is taken care of. There is often an argument that wait times in Australia are extremely long, but the point is, if you are in an emergency, then there is a very high likelihood that you would be taken care of. That's about hospitals. Now let's talk about insurance. Insurance is a highly profit-driven business. There have been cases where essential care has been denied to a patient by the insurance because the said procedure is not covered under the insurance policy. So think about that. Even if you are paying for private insurance, there is a very high likelihood that you would not be paid in case you are in an actual medical emergency. You just have to go on Reddit and check reviews of United Healthcare or other insurance providers, where often because of the denial of such claims, many had to lose their lives. What happened on Wednesday could be a repercussion of years and years of exploitation that the citizens of United States have suffered. Am I justifying it? Absolutely not. But you can clearly see by the response of the people in United States that nobody is actually sad about this. It might be a coincidence, but after this news broke out, Anthem Blue Cross Blue Shield, which is one of the insurance providers in US, who had planned to limit the coverage for anesthesia during an operation in US, rolled back that policy change, and they said the coverage would remain as it was before. Like I said before, killing is not justified, but the response of the residents in US and the citizens of the country should force all these insurance providers and the government to re-evaluate what the country is doing in terms of healthcare before it's too late. So there you have it. The top 5 problems with the American healthcare system. Every system has its flaws, but affordability, accessibility, and fairness should be the foundation of any healthcare model. What do you think? Does your country handle this better? Do let me know in the comments, and do like and share this video if you liked my insights. Our channel is all about the diaspora of India living in European countries, US, and in Australia to come out with videos which might be helpful in showing the world and the global desis the realities of living outside India. Hope you like the video. See you next time. Bye.